Zach. I'll be your nurse today. Could you please state your name and date of birth for me? Okay, everything matches. I'm just going to raise you up here to your full height. Do you have any allergies? No? Okay, are you in any pain? No? Alright, that's good. Just going to raise you up. So today we're just going to be doing a nasopharyngeal suctioning in your nose so that we can help you get to breathing easier. Before I do that, I'm going to take your vitals just so I can make sure that there are no major changes after the procedure is done. So I'm going to keep this pulse oximeter on you for the entirety of it so I can monitor your oxygen saturation. And going to take your blood pressure. Okay, blood pressure is at 120/80. It's good. Take your temperature. Temperature is 98.6. Perfect. And your heart rate was at about 80 beats per minute. And your breath rate about 13. So everything's normal. That's good. That's what we're going to be looking for after the procedure and make sure everything stays the same. So I'm just going to drape this right here, catch any fluid that might fall when I'm doing the procedure. And I'm going to go ahead and come over here and turn the suction on. I'm going to turn the suction on to continuous. I'm going to grab the hose and to make sure I get the pressure right on the vacuum, I'm going to occlude the tip and make sure that the needle falls between 100 and 150 millimeters mercury. And it's at about 110 right now, so that's exactly what we need. I'm going to hang this over the patient, or behind the patient. And before I get started, I'm going to go ahead and give my patient some privacy. All right. Now I'm going to set up my equipment. Make sure this table is above waist level so that when I put my sterile gloves on, it is sterile. Then take the sterile gloves out. I'm going to go ahead and use these sterile gloves because I know that they fit me. But before I put those sterile gloves on, I'm going to take this fluid, grab the label on the inside of my palm, pour the first little bit out, and put the cap face up, and pour the rest into my basin here. my sterile gloves are on. And I'm now going to grab the tubing here. I'm going to hold this in my right hand and use my left hand, my non-dominant hand. This is now my designated clean hand. It's no longer sterile. So I'm going to make sure that I don't touch anything sterile with this hand. All right. Now, once this is put together, I'm going to go ahead and measure the length from the earlobe to the nostril. I'm going to kind of hold my hand there as a marker. And now, before I get started, I'm going to go ahead and move this a little closer with my dirty hand, or clean hand, and not make sure I don't touch this because that is sterile. Go ahead and irrigate the tubing real quick. And as I go into this nostril, I'm not going to do any twisting, and I'm not occluding so that there is no pressure being used. No vacuuming happening. Now, as I pull out, I'm going to do an intermittent suction and twist so that I can get all of the surfaces of the nostril. Okay, now that I've done that, go ahead and irrigate it again. Now I'm going to give the patient about a minute before I do the other nostril. We don't want to suck all the oxygen out of their body. We do want to be maintaining a oxygen saturation of at least, I would say, 95 for this procedure. If it gets any lower than that, it's because you're sucking the oxygen away from them, so we don't want to do that. Okay, now going into the other. Going to go all the way to our finger. Now we're going to do the same thing. Go ahead and clear that out again. And that is how you do a nasopharyngeal suctioning. Go ahead and take that off and leave that there. We're going to go ahead and coil this around our hand and take our glove off around it. So that first glove is off. Okay, I'm going to set these aside because I'm saving that too. And clean up our area. All right, so now I'm going to check my patient's vital signs again. Get this blue pad out of their way. We're going to take the vital signs just to make sure there weren't any major changes while we were doing the procedure. We're definitely paying most attention to the pulse oximeter because that's going to give us the most direct reflection of how their oxygen has been maintained during this procedure. It's still at 98%, so that's great. Go ahead and take blood pressure. Blood pressure is still at 120 over 180. That's perfect. Okay, and now I'm going to turn off the suction. Go ahead and put this handrail back up. I'm going to go ahead and lower you down to the lowest position so we don't have to worry about you falling. Would you like to be lowered down into a supine position or laying flat on your back position? No, this is good. Okay. lower down in the lowest position. Cover, and back up. Make sure they're comfortable. Is there anything else I can do for you? No? Okay, your Paulette's right here. If you need me, please let us know. And I'm going to make sure I have this other handrail up before I leave. All right, that's it.